Good morning, good afternoon, good evening, everyone, depending on where you are. I'm still remember myself, Jameson Iwefo. And yesterday we talked about cardiovascular diseases. We talked about the heart disease, cardiac arrest, heart attack, stroke, atherosclerosis, cardiac arrhythmia, valve disease. Those are the introductory part of it. We did justice to that yesterday. So today is a continuation of our health literacy program, which is even though you have to understand what because some of us don't really have that opportunity to attend classes, workshops, or even have this social media or have access to social media to know more, to be literate on the diseases they're suffering from or their relatives are suffering from. So most of us are being denied of these education and the literacy about the disease they're suffering from. So that's why this idea came up. Let's see if we can use this medium to transmit some of this educational um, thing. So today we're gonna go into the CVDs proper. So I'm going to start with talking about the heart before going to the peripheral, the body, the vessel that supplies blood to the body. So today let's start with cardiac arrest. Your heart works like, as I said before, it works like the fuel pump of an engine. So, and if that fuel pump has a problem, the engine is gone. The same thing if your heart has a problem, you are gone, especially when it stops beating. So that's why cardiac arrest is very, very important for us to understand what is going on. So cardiac arrest happens when your heart, in a simple way, when your heart stops beating. And when your heart stops beating, no more blood is being pumped to your organs, to your general body, and to your brain. And all the mechanisms, all the systems will be shut down. And the compensatory mechanism is the person to do what? Collapse or fall. There's a reason for that. Because the head, the skull, is heavier than the body. The gravity always weighs down. So once the leg is weak and the head is heavy, the compensatory mechanism is for the person to fall down. And their brain is also compensating so that when the person falls down, oxygen and more blood will go to the brain to see if the person will survive. The nature is trying. That's another compensatory system. So because your heart is being controlled by electrical system, just the way your house is, without electricity, without those electrical gadgets in your house, where you come into your house, it will be dark. You can't see. You can't even move around during the night. That's the way your heart is. There's an electrical system in your heart that discharges electricity and what will I call it? That your heart has to pick up, because your heart has two chambers. The first one will pick up, the first one will discharge, and the second one will pick up. Your artery will discharge, your ventricle will pick up. That's what we call pace setter. It has what we call pace setter. That pace setter is where the electrical system will first of all discharge and spread it all over the heart, and the heart will be pumping and contracting, thereby expelling the blood to your body. So, what are the causes of cardiac arrest? What are the causes? The causes of cardiac arrest might be when you have an injury. Maybe at work, something hits you on your chest. disturbing the electrical discharge of your heart. The heart will stop beating. Or normally when you have family, they call it inherited a disorder from your family. It runs in the family. You might not know that you have an inherited disorder in your heart. Yeah, the heart, it's an idiosyncratic thing. It can just happen at it. You don't know. But your heart will just suddenly, maybe at work, you start feeling somehow dizzy. Before you know it, you collapse. That one is inherited. You don't know what's the cause. Or maybe injury of any of your organs. If you are any of your organ in the body has a problem, has an injury, which might discharge something like toxic substances, which your heart don't like, that can interfere with your heart electrical system. Your heart will stop beating. Plus other things that can affect your heart. Of course, aging can also affect your heart. You're not that one, you can't control that one. I've talked about the family history. So these are the causes of cardiac arrest. Now let me move fast and so that we can also discuss about the heart attack. Now, what will you do? What do you have to do when you have for instance, you're in an environment where someone collapses or someone falls? What do you do? I'm not talking about yourself, because if a cardiac arrest happens to you, you can't do anything. But this is why we're here, to learn how to solve this problem in case if it happens. Especially most of our people that are in all these remote areas in the village and small, all these unadvanced, in undeveloped areas where it's very difficult for you to have first responders, all these emergency ambulance and emergency hospitals, and what if they are not? What if they are not there? What will you do? That's why we're doing this thing now, for you to have that knowledge of trying to see if you can help and solve the problem. So when someone has a cardiac arrest, you are somewhere and you are told that, hey, Chiki that just you saw yesterday is right over there, he's lying over there. It looks like he's suffering from cardiac arrest. What will you do? Actually, you might not be certified. You might not be licensed to do anything, but you can suggest. Or if you're allowed, you can help. That's where CPR comes in. Cardiac arrest is not only, CPR is not only used when someone is drowned or when someone is unconscious. Cardiac arrest also calls for CPR. When you see someone on the floor, unconscious, not breathing, you call, no response, nothing. CPR is highly needed. I would have talked about CPR, but I've been watching all these social media, and it looks like CPR education is almost everywhere. I was like, okay, at least most of us must have gotten that, 90% of what CPR is all about. So I will only mention about this CPR here and where it is being applied, yes. So when someone falls, Chijioke falls the other side, and you run to that area, if possible, start CPR, especially when Chijioke is unconscious. Start CPR. You check the artery on the neck, no response, no pulse. Start CPR. You hit Chijioke, Chijioke is no more responding. You shout, Chijioke is no more responding. Start CPR. The CPR you're doing is trying to do what? Is trying to fix that electrical system in the heart. trying to control maybe the irregular beating or the irregular excitation of the electrical system in the heart. Also trying to open the breathing, the air space. That's why when you start the CPR, you have to raise the jaw, try to open the airways of the person. That's why it is called cardiopulmonary resuscitation, because the cardio, which is the heart, the pulmonary, which is the lungs, both of them are involved. So cardiopulmonary, both of them, you are trying to resuscitate, you are trying to bring them back to functionality. I don't want to go to the medication part of it. That one is when that one is a special area on it, where I specialized. So I don't want to go into area of that. But when it comes to the role of a pharmacist, I will still touch one or two of them. How you're gonna take care of yourself and the medication, and how you benefit from your medication. You can buy medication and keep it at home, but you are not getting the maximum benefit from it. I will still tell you that. So another thing we'll now discuss is the risk factors. What I mean by the risk factors are, what are you doing? What is that thing environmentally, unknowingly, behaviorally, or socially that we are doing that is affecting our heart, or that may also cause cardiac arrest? Because sometimes the heart will be weak. Maybe something that we are doing is affecting the heart. What are those things? Number one is when you are taking too much salt. Too much salt. Stop taking too much salt. Because your heart is being controlled by this excitatory something. I don't want to go into that because it's kind of like you might not really understand it. Kind of like elements going in, the sodium will go in, the potassium will go out, the calcium will go in, the sodium will go out. So it kind of, you might not really understand it. So when you take too much salt, it's also affecting the movement of those ions, the movement of those elements in and out of your heart, especially potassium. Whatever you're eating, don't eat. If you go to the market, or if you go to this supermarket or everything, ask for what contains too much potassium. How many of you knows that potassium is a ladle element? If you want to execute somebody, inject high concentration of potassium into the IV, now like in the vein, the person is gone. Once it gets to the heart, it blocks it, telling you that it affects the electrical system in the heart. Once you have too much potassium in your body, it affects the heart. So too much of everything is bad. So reduce and salt also is, of course I said before, it's going to affect the electrical system of the heart. So reduce salt intake. Also do physical activities, physical exercises, try to walk around the street, try to walk around, run around. Reduce sedentary lives. No, you have to be walking around. 30 minutes walk is a very big, it's a very big advantage to your body, to your heart especially. Also, those are the things you can control. You can control the salt intake, you can control physical activities, you can also control the smoking. Another thing that affects the heart so much badly is smoking. If you're smoking, to all these chain smokers, man, you are harming your heart, also your lungs too. And let me tell you something, if you have a cardiac arrest, resuscitating you is gonna be very, very difficult. Very, very difficult. So reduce smoking, or if possible, quit. Now, these are the things I want us to discuss about cardiac arrest. Let me move sharp to um heart attack. Some of us might think that both of them are the same thing. No, both of them are not the same thing. Heart attack is when part of your heart stops working, is not functioning very well. The medical term for it is myocardial infarction. You start feeling pain. Hey, my chest is paining me. It's because a part of your heart is not getting what it wants. Maybe there's not enough oxygen, there's not enough nutrient going to that particular part of the heart, because the coronary artery that supplies things to that particular part of the heart is blocked or is not functioning well. Now you may ask, how is it gonna be blocked? How is it gonna be blocked? What do I mean by blocking? The coronary artery is very, very tiny, it's very, very small, that if something larger than the lumen, something larger than the size of the thing is trying to pass through it, it will block it. And thereby denying passage of oxygen, blood to the part of the heart. And before you know it, that area will start dying. And when that area starts dying, pain comes in. And what are the signs? The signs are the chest pain, neck pain, your shoulder. You'll be feeling weak. You'll be gasping for air, finding it difficult to breathe, shortness of breath. When you see someone around you, if you're very, very observant, when you notice something like that, or when that person is complaining about chest pain, look at all these signs: neck pain, struggling to breathe. That's heart attack. Now, what do you do when you notice something like that? Or let me go to what are the causes. Of course, the same thing. The causes are too much fat, too much cholesterol. Because when you're eating cholesterol, it affects your heart too, in the sense that the bad cholesterol will be depositing on the blood vessels, thereby reducing the lumen, the sizes of the opening in the vessel. Excuse me, hold on one second. Yes, so that's why I always say reduce hand in cholesterol, because cholesterol is not good in your health, especially when the good one is less and the bad one is high. We call the good one HDL and the bad one LDL. And the most wicked thing there is that the HDL, they are not much in the body. So the LDL is always high, it's always there, trying to outweigh the HDL one. So, but when you want to reduce intake of cholesterol, it's gonna reduce the LDL, and the HDL will be coming up, trying to clean up the mess of the LDL. So how do you help yourself with that? You reduce smoking too. You reduce harmful intake of alcohol too. Engage yourself in physical activities. I said it before, walking around will help. Exercise will help. Running will help. As long as you're sweating. If you can sweat for like 10-15 minutes, it's a very good benefit to your heart. Now we've talked about cardiac arrest and heart attack, and the risk factors are the same thing. Now I'm gonna give you a number in case if you see someone that collapses or someone that falls or around you, especially the Inyi people, you call this number. Ambassadors Club of Inyi, they provided an ambulance, which they said is kind of like an emergency thing over there. So I will give you the number. Let me give you the number. If you're on the screen, just copy this number. I have it right here. Just copy this number. It will help if you see anyone around collapsing, falling within the Inyi environs. You can call 070 359 20508. I think this number, I don't know if this number is right, but I will still check it. I will post it and I'll put it in the YouTube too, so that you will copy the number in case you see anyone collapsing or falling. Just view the environment, make sure the person is lying with the back, raise the head up, start CPR, and call this number. It will go a long way. You will save a lot of lives. You will save a lot of lives. Okay, we'll come to an end on this segment, and tomorrow we've talked about the heart itself. Then tomorrow we'll go to the peripheral part of it, which is the vessel, and how to take care of it. All right, I still remain myself, James Newhelfer, and have a wonderful day. Thank you very much.